all, welcome and welcome back to my channel. On this page, I talk about technology and money and hockey and also trending news. If you're new here, I'm glad you made it here either via the algorithm or if someone shared one of my videos with you. And if you're returning, I'm glad you're back. I hope everyone is having a good spring so far. Wherever you are, I just hope everyone is well. Today, I wanted to talk about artificial intelligence will not replace nurses. But now this is a commentary on the news that has come out this week. Well, this AI technology has been around actually for a few years, but they have made some tremendous strides in their product. And I'm talking specifically about Hippocratic AI's new partnership with NVIDIA, and they are coming out with AI agents. Specifically, they are using generative AI to have AI nurses. And let me tell y'all, the response, the videos I've seen on TikTok from nurses, I've seen articles, I've seen takes from news, healthcare technology news outlets, some in favor, some in not, and not. Overwhelmingly, the videos that I have seen from nurses on TikTok and other social media platforms have been AI, artificial intelligence is replacing nurses. Let me just say, as the title of the video says, artificial intelligence will not replace nurses, but so there's some things I want nurses to keep in mind. And when I say nurses, I've said this before, when I say nurses, I'm talking about registered nurses, licensed practical nurses, licensed vocational nurses, certified nursing assistants. I want to be inclusive in my commentary when I say nurses. So there are some things we need to keep in mind as healthcare professionals about this technology, okay? So I'm going to share my screen and let you know specifically. I'm going to share a very short video. It's less than a minute and a half about NVIDIA, which is Hippocratic AI's new partnership. Hippocratic AI's new partnership with NVIDIA. So I'm going to share a video and then I'm going to delve into some specifics about it. Okay. Just give me a moment. Yes, we want to. Okay. All right. You all should be seeing the video and I'm going to play it. Let me make sure the volume is all the way up. Let me make sure all my volume is up so you all can hear it. All right. All right, so let's play it here.
Hi, Sarah. I'm Rachel, your AI care manager. How are you doing after your appendectomy?
I'm good. I'm glad to be home with my dog, Dennis.
It's great to hear that you're back home with Dennis. I noticed that Dr. Chang has prescribed you some antibiotics, specifically ciprofloxacin and metronidazole, due to your ruptured appendix. Were you able to get these medications?
I was. I did forget to mention to the doctor that I am allergic to penicillin. Is it still okay to take the medications?
Great question. The antibiotics you've been prescribed, ciprofloxacin and metronidazole, don't contain penicillin. So it's perfectly safe for you to take them. Can you begin taking them today?
Yeah, I certainly can. Do you have any tips for faster recovery?
Given that you have diabetes, keeping your blood sugar levels in check will be beneficial for your wound healing. Your hemoglobin A1C was at a healthy level of 5.5, but your glucometer readings from yesterday were a bit on the high side. So keep taking your metformin and try to steer clear of foods high in carbs. How does that sound to you?
I think I'll be able to avoid the carbs for the week. I need to go right now, but it was great talking to you.
I'm glad we had this talk. I'll pass along your progress to Dr. Chang.
Goodbye.
Goodbye.
Okay, so that's the product. Okay, I'm going to share my screen once again. Oh, let me stop this video from replaying. All it is. Okay, delve a little bit more into this technology and how it works. Okay. About very high level. And as always, I will be sure to leave a link to all references in the description box once the live has wrapped, so you all can go explore and learn more for yourselves. I like to say, don't believe anything that I say. Don't believe anything that any creator on a social media website, whether it's YouTube, TikTok, Instagram, LinkedIn, etc., says. Always do your own research and reference multiple sources. So this source is from the advisory board. So I follow quite a bit of advisory board information. They have newsletters. They, of course, because I work in healthcare technology, I focus on the white papers and news articles that they do around healthcare tech. And they are known to be a reputable source. So AI nurses, inside NVIDIA Hippocratic AI's new partnership. So NVIDIA has announced a collaboration with Hippocratic AI to offer virtual nurses powered by generative artificial intelligence, a development that company leaders say will help mitigate widespread staffing shortages and increase access to high quality care, all while improving outcomes for patients. Okay. So what they're doing is basically, this is virtual nursing. I've talked about virtual nursing. Virtual nursing is actively being rolled out at many large hospitals and health systems across the United States, really across the world, but I'm based in the United States. So virtual nursing is not new. It is definitely exploded, especially since the pandemic. Okay. Just a new model of care. Okay. So voice-based, in this instance, these AI nurses will be known as AI healthcare agents, which will be powered by a large language model, which is a type of artificial intelligence. So voice-based digital agents powered by generative AI can usher in an age of abundance in healthcare, but only if the technology responds to patients as a human would. So you think about, for folks, maybe Gen X, millennials, 80s, 90s baby, or even now, when you call into a phone call center and you get one of those automated voices, right? And some people just bypass that and say human being because they don't like talking or interacting with those not voice recognition, but those voice systems. Okay. So it sounds to me very similar to that, but it would only work, what this company is saying, if it responds to patients as a human would, because some people just don't like talking to robots or robotic voices. So this technology, what caught my eye with this is this large language model is trained on a massive collection of proprietary data. Now I want to know, like where is that data coming from, right? Because when you train on data, you have to be careful to make sure it's not biased, that it's inclusive, that it, is comprehensive. But the LLM is trained on a massive collection of proprietary data, including clinical care plans, healthcare regulatory documents, medical manuals, drug databases, and other high-quality medical reasoning documents. So I always talk about, at least I think about, how something is vetted and tested, like what is the QA process like? So apparently this product has been tested by more than 1,000 registered nurses and 100 licensed physicians in the United States. They're also working with over 40 beta partners. So I don't know if those beta partners are hospitals, health clinics, ambulatory clinics, outpatient centers. I'm curious to know the beta partners. I'm sure it may be out there. But anyway, so they have been beta tested to test the AI on different responsibilities, including chronic care management, wellness coaching, health risk assessments, and more. Now, this is where it really got interesting to me, okay? Because they compared the AI agent, the AI nurse, the AI nurse's effectiveness to a human nurse. And this is where it got interesting. When they compared the ability to identify a medication's impact on lab values, the AI nurse had an accuracy of 79% versus 63% in a human nurse. Okay, that is not statistically insignificant. That is a big jump. That is a big difference. We're not talking about a 1% difference here. We're talking about almost a 20% difference in the accuracy in performing this task between a human nurse and an AI nurse. Okay. Also comparing identifying condition-specific disallowed over-the-counter medications, 88% for the AI nurse versus 45% the AI nurse. That is huge. That is a big difference, okay? It's almost half, but not quite. Correctly comparing a lab value to a reference range, 96% performance with the AI nurse versus 93%. And then also detecting toxic dosages of over-the-counter drugs, 81% versus 57%. Again, these numbers are not small, okay? That's quite significant in differences in performance, okay? Let me go back to the article. The AI agents have so NVIDIA and Hippocratic have touted AI agents to ease current labor shortages in the healthcare industry. Y'all, I've talked about the nursing shortage. People have been talking about the nursing shortage since I started becoming a nurse over 20 years ago. And it is only exacerbated, especially since the pandemic. And there's so many opportunities for nurses, but also what is happening at the bedside for nurses in terms of staffing, in terms of workplace violence, in terms of supply chain, in terms of just how the world is changing and how the patients, because the care models and insurance is changing, the patients who are admitted to the hospital are more sick or have a higher level of acuity than say they did 10, 15, even 5 years ago. But the World Health Organization estimates that there will be 10 million fewer healthcare workers by 2030, mostly in low and middle income companies. So when I saw that, that made me think about how would that impact mostly low and middle income companies, right? So healthcare workers, you think about not just hospitals, but also home healthcare agencies, nursing homes, outpatient clinics, say dialysis centers. Y'all, that is significant. And you think about the patient population and those health outcomes for patients who may be in those low and middle income companies, what their short-term and long-term outcomes will become. Okay. They say the AI program is more cost effective than real nurses, is the only scalable way to reduce the shortfall of healthcare workers. The cost of operating the AI agents, aka AI nurse, is $9 an hour. In comparison to the median pay for registered nurses in 2022 was $39.05 an hour. So let's multiply 39.05 to see how much that is annual salary. So 39.05. If you're ever curious, when you look at an hourly wage, how much that would be an annual salary, all you got to do is multiply by 2040. That's something one of my old bosses, who was COO of a company I used to work for, that was something he taught me early on, it never slipped my mind. So anytime you ever want to know what an annual salary is by looking at the hourly salary, whatever the job, whatever the number, just multiply by 2040. So when we take 39.05 and multiply it by 2040, that's $79,662 per year. And then they talk about with generative AI, they have the opportunity to address some of the most pressing needs in the healthcare industry. So once again, I'll say artificial intelligence will not replace nurses. But now, yes, this is a viable solution. And the responses that I have been seeing from nurses across social media is AI is replacing nurses. AI is replacing nurses. It's cheaper to have an AI nurse. Companies and hospitals will do everything except for paying nurses. Artificial intelligence will not replace nurses. But there are some things that nurses, and when I say nurses, I'm talking about myself, you, me, etc., will need to do. So I'm going to share just a few more things to keep in mind about how technology is changing and changing healthcare, and what nurses, as I'm getting to the point of what nurses will need to do as these technologies continue to evolve and be present. Okay, so HIMSS had their big annual worldwide conference just a few weeks ago in Orlando, Florida. And of course, I didn't go to HIMSS. HIMSS is very expensive to go to. I've presented at HIMSS. I had a poster at HIMSS a couple of years ago. It's a very expensive conference to attend. But I always like to stay when HIMSS has their conferences and things. I always like to see what was the hot thing at HIMSS. One was Mayo Clinic is building, like it's actually being built right now, a $5 billion digital hospital. And again, I'll leave a reference to this article in the description after the live. But anyway, to keep this short, they're talking about this new hospital that will have over 2.4 million square feet of space, that will have a subway system, but they will have a subway system connected to a logistics center from which robots will deliver supplies. They're going to have virtual reality experiences. They also said, imagine a future where you need some gauze and you go into the supply room and you say gauze, and a wall panel opens and the supply is delivered to you, or even bringing you product. I don't know, as a nurse, how many times I have gone into the supply room, especially if you're new to a space, new to a unit, and you're just literally spinning your wheels looking for supplies. But also they talk about how this digital hospital will know like your room preference, your temperature preference, what your hospital preference is. And they talk about, imagine a patient comes in, they're receiving treatment, and your favorite music starts to play ambiently in the background. That's one thing, okay? Another thing that came out of HIMSS, I'm going to share here really quickly, just to let you all know, yes, technology and artificial intelligence is being embedded in healthcare. Nurses will have to be prepared, but they will not be replaced, okay? AI cannot replace nurses. But I did also want to share, let's see, here we go, 6 takeaways from HIMSS, in addition to that digitized hospital. Oracle, Google, they talked about their generative AI offerings. One is using a clinical documentation tool called Augmetics, which uses a large language model. Also, they talked about how Stanford is doing a lot in informatics. And I know they have an informatics, healthcare clinical informatics program out there, in addition to all the work they're doing in AI. But they're also deploying DAX, which is a voice technology that uses AI to help the provider and also the nurses with their clinical documentation to reduce the burden of documentation. Now, I do know Nuance as a company, they employ nurses, right? They have nurses that work for their company that is helping to test and QA and work on this product. Let's see, hospital at home. I've talked about hospital at home and how hospital at home is not your traditional home health care model. Hospital at home is literally a hospital at home, and it uses a lot of analytics and other AI products to help care for a patient in the comfort of their own home. And I talked about also about the $5 billion digital hospital. One other thing that I'm going to share, just to keep this short, I won't share the article, but I'll leave a link. So Stanford Health is also expanding. Again, they're not only deploying the AI powered DAX with that clinical ambient technology where nurses in the room and they're just having a natural conversation with the patient as they're assessing the patient, instead of the nurse having to remember or type in the computer while they're assessing the patient, or right after, they can just talk their assessment out and the technology will summarize your clinical documentation for you. And then this other artificial intelligence product that I came across, AI and how it's going to impact nurses, is being done at Northwell Health. Now, Northwell Health is based in New York. It is one of the largest health systems in the United States. It's like in the top 20. It's really large. Okay. This is not a small health system. They have about 80,000 employees, and I think their hospitals combined have just under 7,000 beds. I don't know how many hospitals they have in their health system, but I do know, I looked up earlier how many beds that their health system has, and it's under 7,000. That's huge in comparison to, say, a large health system in North Carolina has just under 3,000 beds. So a hospital health system having 7,000 beds just tells you how large it is. But this health system just invested in a startup that is using AI to develop conversational artificial intelligence platform that mimics human speech. Okay. So they backed $50 million in Series B founding, and the name of the product is called HIMSS, which was founded by a former Google researcher to provide near human level conversation. And as I was saying earlier, with these AI models, the conversations that AI nurse that I was showing earlier, the video I showed earlier, people don't like interacting with robotic type. They don't like having robotic type conversations. Think about if you call into like a customer service line and it's like a robot. And most people, I know me, when I start hearing those things, I just say human being. I don't want to talk to a robot. But anyway, Hume is developing a near human level conversation with AI. And it is to have a, quote, emotionally intelligent voice interface. Now, whether people realize it or not, healthcare, with them deploying AI, many other industries have already been using it for years. The banking industry, the trucking industry, fast food, retail. There are some fast food operations, especially in larger cities, where you don't interact with a human being at all. Okay. And they're using AI powered technologies for their business. So this is a short article. It says health systems are increasingly using conversational AI bots to talk on the phone with patients, appointment scheduling, care management, etc. And the platforms are beginning to sound more like living, breathing people. Interesting. And that AI is going to be trained, or is trained, to use empathetic language to know when to stop and start speaking, and learn from the rhythms of human speech, such as ums, ahs, and to keep becoming more lifelike. I say again, artificial intelligence will not replace nurses, but so I talked about that. So what do nurses need to do to prepare? Because I say artificial intelligence will not replace nurses, but nurses will need to, number one, upskill. I've talked about upskilling in the past. Now, if you're talking specifically about artificial intelligence and technology, nurses can upskill in AI itself. There are plenty of free, reputable, credible courses and certificates nurses can take on, like LinkedIn Learning, the Khan Institute. There are just different platforms, courses in data science, courses in machine learning. There are free videos on YouTube from reputable content creators. Just familiarizing yourself with the technology, especially if you're working in an organization that has not yet started deploying the technology, but likely will be soon. Upskilling and being prepared for these technologies will put nurses so ahead of the curve. Other clinical specialties, such as radiologists, for example, have already been using artificial intelligence to help them with their clinical diagnosis. Pathology, right? Those are the doctors that look at human tissue to help diagnose diseases. They have been using AI. They are not being replaced. Their work is being enhanced. Number two, nurses should stay informed and mindful of what's going on in your profession, right? Us and when I say nurses, us, I'm talking about me, we, us, need to be aware of these technologies as they're being deployed, as they're being rolled out. There are opportunities to work. For example, like I know Nuance has nurses that work for their company. Informing yourself if you're interested in that technology, even if you don't take a course, just know that it is coming. So when it's deployed at your healthcare organization, you are prepared. You are more skilled. You are more adept to adopt the technologies, which goes to my third point, continuous learning, but also being willing to adapt and adopt. Because artificial intelligence will not replace nurses, but nurses must adapt and they must adopt, okay? Because the world is not changing. The world is changed, and it's going to continue to. We don't want to become obsolete as a clinician. We want to make sure that we are upskilled and performing at the highest level of our licenses to provide the highest level of care to patients. I know that nursing educators and some nursing schools are already using artificial intelligence for teaching and for student learning. Okay, there are nursing schools out there that have hospitals of the future, quote, where nursing students are learning. So I know there's some nursing schools that don't have it, but there's some there are. Okay, so just to alleviate or to talk through some of the other videos I've seen from nurse content creators saying that nurses will be replaced by artificial intelligence and AI nurses. Artificial intelligence will not replace nurses, but we have to be prepared for the future because it is here. Thank you all so much for listening. If you made it this far in the video, please like and share. Liking and sharing does two things. It helps this content get out into the algorithm so that it reaches more people, and it encourages me to continue creating content that you all find helpful, useful, and informative. Thank you, and I'll see you all in the next video.